Good afternoon, everyone. Welcome to day 151. Dr. Fitzgerald sends her apologies. She is detained owing to the court case, and the Premier Designate asked me to tell you that he's only really just started his briefings, and as soon as he has had those done and feels comfortable, that he would join in again with these weekly briefings. So I'll try and be a pale imitation of Dr. Fitzgerald. I'm pleased to announce today that there are no new cases of COVID-19 in Newfoundland and Labrador. And indeed now we have no active cases in Newfoundland and Labrador. We therefore have 263 cases who have fully recovered. This is excellent news, and again it's a testament to the people of this province and their desire to do their part, and for that I thank you. We've had a total of 26,010 individuals tested over the course of the pandemic. Globally, however, I think it's important to just sit back and realize that we are still in the middle of a pandemic. And indeed, if you look at what was our holiday weekend between Friday and Monday, the global count of COVID cases increased by 1 million in simply 4 days, due mainly to Brazil, the United States, and Italy is now undergoing something of a resurgence of case numbers. On a national level, we've heard from Dr. Tam and her deputy that it looks like the trend for Canada will be towards sporadic clusters rather than necessarily one larger wave, but that cannot be assumed. We will continue to see cases on a go-forward basis. That's pretty well a certainty. And again, of interest, it seems now that the general consensus is that this may be a way of life for us to the end of 2021 and possibly even a little bit longer. Even under ideal circumstances, a vaccine is still between 12 and 18 months away. We will still need to exercise vigilance, and we still need to persist with the measures that have served us well thus far. Again, at the weekend with the warm weather, we saw pictures in social media of beach events, beach parties, and concerns about this. I think as officials and public health experts, we can only provide advice in certain circumstances. And whilst there are limits enforceable under special measures orders for gatherings and social events, each of us has a responsibility to ourselves and to others to look at any situation we might put ourselves in and say, is this responsible in the light of COVID-19? What is the sensible low-risk option for myself or my family? You have the ultimate choice and the ultimate decision. For those facilities that have an operator or a manager or a group responsible for them, they too have some responsibilities in terms of signage and making clear expectations around how these facilities are used. We all have a part to play, and other jurisdictions have seen the challenges that warm weather and beach parties have brought to them. Physical distancing remains our key tool in preventing or reducing the spread of COVID-19. And Dr. Fitzgerald has used her mantra before as a guide for us of people, space, time, and place. And what that really means in simple terms, if you're going to put a lot of people in a very small space for a long period of time, the chances of one or other of you acquiring or spreading COVID, if it's there, really rise dramatically. And so for each situation you or your family might encounter, you have to do that calculation in your head. People, as few as possible. Space, as large as possible. Time, as short as is reasonable. Outdoors rather than indoors. Those are the metrics that you can use to assess any given situation from a risk perspective. It works. From the point of view of distancing, we've seen examples of how this can work in small businesses as well as larger ones. I dropped off my two Westies at Little Angel's doggy daycare, and I was never any nearer to Jackie than about 8 feet because of leads and things like that. It can be done, and that's an excellent example of some responsible activity by a small business operating out of their own house. It's also led us through COVID to newer ways of doing business. We have seen the rise of virtual care in this province. It's gone up by 699% between the beginning of the pandemic and the figures my department provided me last week. It's never going to go away. People who have used it have found it to be excellent. The quality is excellent, and the convenience has been good. It is certainly a lot lower risk, where a sensible option from a clinical point of view, to have an interaction with a healthcare provider virtually, if it can be done that way. Under that virtual care rubric, we've seen virtual fee codes negotiated with the NLMA, and that will take us out to October of this year. And we are in the process of formalizing negotiations around substantive changes to fee codes as part of our major negotiations. But should the pandemic persist, and I'm pretty sure it will, then we can roll those codes over without any difficulty. 811, we've seen an integrated nurse practitioner program instituted for episodic acute care for those people who don't have a regular primary care provider. It fills a gap and saves the need for traveling to a facility and the risk that that might involve if COVID is prevalent in your community. Mental health has been another great area of success. The Bridge the Gap portal has seen incredible use and major success. It has seen a 406% increase in traffic over the course of COVID-19. We have had discussions with the International E-Mental Health Collaborative, and Newfoundland and Labrador is regarded not only in Canada but across the world as a leader now in this area. We have provinces in Canada from BC to Nova Scotia looking to try and mirror our efforts in this regard. We have New Zealand wanting to know how their system can adapt our programs, and it is a testament to the staff here, to Dr. Cornish's groundbreaking work at Memorial, and the whole of Towards Recovery's Step Care program that this has taken off in the way it has. And COVID-19 really gave it something of a kick in the pants to get going. It's really good. We've also seen now changes in the way government operates with virtual government. MyGovNL has been in operation for some time, but a little while ago we soft launched MCP card renewal. This is now available through the MyGovNL account, and you can indicate your desire to be an organ donor and renew an existing MCP card, all from the comfort of your own home. This site has seen an astounding increase in utilization between March and now. In a matter of only 5 months, the number of accounts on MyGovNL has gone from 7,500 to over 70,000 in just 5 months. A great success, and obviously a great convenience and help for those who've used it. Again, back to health and virtual access. There is now the opportunity for people requiring blood work at the Major's Path clinic to schedule their own blood work appointment online. And once this pilot scheme has been evaluated, the plan is to, if successful, rapidly push this out to the other regional health authorities for them to use as laboratory services become a slightly different creature than they were before. Across the RHAs, laboratory services are anywhere from 94 to 102% of their pre-COVID levels currently. So again, congratulations to the RHA for pushing this ramp up over the last alert level. It's been great news for the people of the province. And finally, there's an element of our government policy which has been there since the beginning but really understated, and that's health in all policies. This was a mandate letter issue of mine. It's baked into the Public Health and Health Promotion Act now. We're only the second jurisdiction in Canada to do this, following on from Quebec. And what it is that government policies and government legislation should all go through a health lens. And whilst we had a team within the Department of Health and at one stage in Cabinet Secretariat looking at Cabinet papers and legislation, COVID-19 has really provided a new impetus for health in all policies. And indeed, I would argue that this media event is a perfect manifestation of that, because just about everything to do with COVID-19 has been looked at through a health lens. Public health in all policies has arrived and it's here to stay. We have, as a department, as a unit within the Department of Health and Community Services, looked at a huge variety of plans from business response team, from private operators, from industry groups, from sports sector representative organizations as to how they might cope with COVID. Public health have provided a lens and an input on it. But at the end of the day, we in health don't have any great knowledge of how these systems and these organizations necessarily operate. So you'll see an education plan for the reopening of schools. That's had a health lens cast on it. But that is education's plan. It's education's to operationalize. We've had great collaboration with the oil and gas industry, and they have submitted very detailed back-to-work plans for the offshore. They have been looked at by public health. They've been tweaked by oil and gas in the light of developments. And it's a testament to the fact that there have been no cases in the oil and gas industry as to how that mechanism has worked. But that is their plan. They manage it. They operationalize it. But there's been a health lens cast upon it. And these are policy changes through government that I think will echo down the years as COVID hopefully fades with the passage of time and the arrival of a vaccine. So with that as a recap, there are no new cases of COVID-19 in the province today. There are no active cases of COVID-19 in the province today. And I would end as Dr. Fitzgerald does with her famous quote of "Hold fast, Newfoundland and Labrador, stay the course, and remember, people, space, time and place. Keep your distance and wear a mask if you can't." So with that, I'll take a pause here and I'll throw it back to Ms. Dix-Payton for the rest of the event. Thank you.
Thank you, Minister. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are for Peter Cowan of CBC News. Please go ahead.
Mr. Haggie, the federal government has released a COVID-19 notification app. Is this replacing the NL app, and when will that federal app have the full support for this province? So, for example, if I test positive today, right now, I can't get the code needed to enter into the app to cause the people to get notified, for example.
There was a discussion with the federal government right back at the beginning about contact tracing apps. And as we had begun to develop our own, it became apparent that the feds had this particular version that they wanted to be used, and it could be flavored to some degree locally. So we kind of changed streams. We followed on behind that. It's rolled out in Ontario. And we are in the final stages of discussions with the feds now about our own rollout. I can't give you an exact timeline. When last we discussed this, the answer was soonish, which I would take to be maybe 3 or 4 weeks.
There's a lot of uncertainty about when travel may open up to the rest of Canada, which is an issue for businesses who are wondering if tourism is going to increase this summer, for people who maybe want to be reunited with families. With the outgoing Premier's promise that people will be given lots of notice before travel is allowed, does this mean the Canada bubble won't happen before the school year resumes?
It would be difficult to put a time on it, Peter. I do know from discussions at the health minister's table that it's certainly a live issue. There has been no discussion about a time for when this may or may not happen. I know other jurisdictions in Atlantic Canada are discussing it too. And obviously, if we don't all go together at the same time with this, and certainly from our point of view, we have no time in mind. And you're right, we would give plenty of notice. I think if one of the jurisdictions was to go out in front of the others, that would create a change within the Atlantic bubble itself, potentially.
And at the Liberal Leadership Convention, there was lots of physical spacing. I've heard from parents and teachers who saw those images and have said, in a month when schools open, that sort of physical distancing is going to be impossible in classrooms. How do you respond to their concerns that there seems to be a double standard, that the protections that we are going to have for children in school are going to be much lower than the protections and the restrictions we have in place for adults when they get together?
I think really the challenge there lies around uncertainty. It's not yet been released in terms of the operational details of what a school classroom would look like when school reopens in early September. Those discussions, I understand the fears. I get the same emails that probably you do. So I would direct you to education or the school district. Those are operational issues, and they will be able to answer them.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi there. Minister of the province, I got a letter last month requesting the province include Quebec's lower North Shore in a travel bubble with the island of Newfoundland from the mayor of Blanc-Sablon, among others. Is that something that the province is going? Is that a request that the province is going to grant?
The issue around the travel bubble for the lower North Shore is a staged affair. From the point of view of local travel, because of the connections between Blanc-Sablon, Forteau, Lancelot, Lanse-Claire, and those kind of communities, those people do have the ability to travel within that more localized bubble. As for opening up the island portion of the province to residents of Quebec, that decision has not been made. I do know that our Chief Medical Officer, Dr. Fitzgerald, spoke with Quebec's Medical Officer of Health on Friday of last week. But for residents of Blanc-Sablon to come and camp in Pasadena or their camper in Gros Morne, that's no different from my point of view than someone from Ontario or Alberta wanting to do the same, and they fall into that category at the moment. I don't foresee that changing in the short term. That is, however, a decision that would be made on the advice of public health.
The request they're making is for just the lower North Shore, which has had 0 cases since the very beginning of the pandemic. And so why, those people are asking themselves, why is Newfoundland allowed people to come from the other Atlantic provinces where we have seen cases, but not this region of Quebec, which is isolated and hasn't had any cases since the beginning of the pandemic? What would you say to them?
It's not totally isolated. It is a functioning integral part of the province of Quebec, just as Parry Sound is integrated with Ontario. And so at the moment, the advice from the Chief Medical Officer of Health is that this is a reasonable compromise. And we will, as we do with all our travel restrictions, look at that on a regular basis in the light of evidence and the changing demographic across Quebec and Canada.
And one final question related to the North Shore. A little bit confusion about what the limits are for travel into Labrador. How far can residents of that region of Quebec actually go into Labrador, and how long can they be there?
It's a day pass, that I do know. The exact distance along the lower North Shore, I will get that for you. I wouldn't like to be misquoted. I'll find that out, and my staff will send that to you before the end of the day.
Thank you.
Our next questions are from Michael Connors of NTV News. Please go ahead.
Hello, Minister. Dwight Ball signed off from these briefings last week, and you mentioned that Andrew Furey is still getting briefed. And the government is in a transition phase in general now. How would you say this transition phase is affecting the work of the Joint Public Health Committee and the government's response to the pandemic in general?
Well, the Joint Public Health Committee met this morning. I chaired it. It functioned as well as it has done on the previous occasions. As far as the department functioning, I'm the Minister of Health until a Premier tells me I'm not. And I would say that it has not impeded the function of the department at all.
And also, Dr. Fitzgerald is not present today. There's a court challenge that began yesterday against the travel ban. Has the preparation in testimony and that sort of thing for this court challenge, has that affected the work at all of public health in dealing with this pandemic?
It's occupied Dr. Fitzgerald for sure. There are her colleagues who have helped and stepped up to fill in the void as she's had to prepare for this. And fortunately, we have had a good run, as it were, of reports from the lab. So no, it hasn't produced an adverse effect thus far.
And there was some discussion about schools earlier. We're about a month away now from the first day of school. I realize this isn't your department, but when can we expect to see detailed plans from the school boards on what school reopening is going to look like?
I was speaking to Minister War this morning on exactly that topic. He didn't give me a definitive date for that, and I would suggest that that's a very good question to ask him or his department.
Our next questions are from Victoria Badcock of the OCM News. Please go ahead.
Staying on the topic of back to school, has government or will government be purchasing all of the cleaning supplies necessary for that transition back?
My understanding that is done through the school board, the Newfoundland and Labrador English School District, and I would direct you to them. I can't see why they wouldn't be.
And with masks during back to school, Alberta has recently made masks mandatory for all students grades 4 and up and staff and teachers. Any update on the mask guidelines in Newfoundland and Labrador?
No, I did notice over the last few working days that other jurisdictions had expressed opinions on masks. I think, just like if you go back to March, we as a government didn't recommend masks, and if we did, at that time we regarded non-medical masks as something of a lesser option. And you can see how over the course of COVID that has changed. And the guidelines are different. Our challenge is that this is a novel coronavirus. It's new, and what we understand about it is now different than it was before. If the evidence about masks in school is such that it would be a significant benefit in terms of reducing risk, then that will become apparent from recommendations from Dr. Fitzgerald's team. The other new twist is there was very recent discussion in academic circles and the media about the use of face shields instead of masks. And certainly from the point of view of the hearing impaired community and those with individuals on the autism spectrum disorder, the ability to see the face and mouth and facial expressions would add a whole new improved dimension to interactions. So again, it's not only just about masks, it's about face shields, and that evidence could change in the next week or two. If it does, then we will change our recommendations.
Thank you. And each day we receive the number of people who have been tested. Does this include every single person who was tested? For example, would it include people who must be tested to get surgery or other procedures in the hospital?
This is a cumulative number of every unique individual who has had a COVID-19 test in the province since the start of our numbers. So those groups that you mentioned would be included. And often you see an increase in testing at the beginning of the working week, which reflects preoperative and pre-admission work through the regional health authorities, because that's part of our Sentinel surveillance program.
Thank you.
Our next questions are from David Marr of The Telegram. Please go ahead.
Thank you very much. Minister Haggie, I'm wondering if you could tell me how many exemptions have been granted for entry into the province since the introduction of the travel ban.
I can get the exact number for you, David. That's not a problem. My ballpark is slightly over 14,000.
Thank you. And recognizing that the court case is ongoing, I'm wondering if the department has, or government broadly has any kind of backup plan in the event that this that the travel ban be struck down in whatever form that might take.
Well, I mean, the one thing that's certain is in a court case, you don't make the decision. In terms of what our options would be, we would simply have to study the decision from the court if we found ourselves in a situation where we had to change the travel ban because of a court decision. So it would be difficult to speculate, but I think one of the things that has become apparent is the degree of flexibility within public health and communicable disease specialists in terms of responding rapidly to a changing environment, whether that's due to the disease or due to court decisions or other external features. So I'm confident that staff will be able to craft something if we need to.
Okay, and we've been sitting in alert level 2 now since about the end of June. So we're more than a month in this state. I'm wondering, is there any plans or any idea when we might shift to alert level 1, and just how would that be different from the current state of affairs?
Alert level 1 would allow us to remove some of the seeming inconsistencies. We've said all along that actually shutting the province down and kind of going into the siege mode was really the easiest bit, and that opening up would be a challenge because as we did, and we did it in a controlled way to try and manage risk, it produced some inconsistencies. So a move to level 1 would be an opportunity to try and remove that. A move to level 1 would allow us to look at apparent inconsistencies between, event sizes and sizes of gatherings. And again, this is a discussion within public health, and I think that we may be again in that soonish category. Sometime within the next 3 to 4 weeks, we would be in a position to announce when that might happen.
Thank you.
We have some time left before today's event concludes, so we're going to start with Peter Cowan again, and we're going to give each reporter an opportunity to ask 2 more questions. Please go ahead, Peter.
Minister Haggie, 1 in 4 Newfoundlanders and Labradorians have high blood pressure, and pharmacies are one of the key places that a lot of people go to check their blood pressure because they have free blood pressure cups there. Those have been out of order since the start of the pandemic. Are there any plans to try and make sure that people do have access to be able to monitor their blood pressure on their own?
Certainly for those clients with a card, an NLPDP card, or who are on income support. So that's kind of the group that the province has taken on responsibility for providing care like that. There are options to access a device that you can use in the comfort of your own home to measure your blood pressure. For those people who have private insurance or would normally self-pay, I would leave that in their hands.
But is there an actual plan to try and address these public, for example, the services that pharmacies have offered in this regard and come up with a way to be able to offer that again?
Well, I mean, from our point of view, the responsibility around income support and NLPDP clients is met by the fact that they can apply to that program and get a blood pressure cuff for their own use. The issue around how a private business chooses to supply its own services, I think would be better addressed to the Pharmacy Association, quite frankly.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi again. Just to follow up on the Quebec Lower North Shore situation, I just want to understand if public health says that this region of Quebec is still part of the larger province, which has a lot of cases, and for that reason we're not going to allow those people to go to Newfoundland, then why would we allow those same people to go to Labrador, where we know access to healthcare is even more difficult in a lot of cases? How do you explain that?
We are in a situation of uncertainty, and what we're talking about is risk management, not risk avoidance. Blanc-Sablon itself has a small population, and the interaction that was asked for was for family issues, but also for medical appointments. There's a lot of cross-border traffic there in both directions, where residents of Forto receive healthcare services through the Régie, Blanc-Sablon, and vice versa. So again, it was to make a step that seemed reasonable at the time in the light of the circumstances prevailing currently. It is one of those decisions that will be reviewed on a regular basis. The ask to be included in the Newfoundland island bubble and the wider Labrador bubble is under consideration, as are requests from other provinces to have our borders opened up to them. That's going to be made on public health guidelines, and I'm sure it'll be equally as controversial as this one.
Thank you.
Our next question is from Mike Connors of NTV News. Please go ahead.
The Tories have been calling for an expansion in testing. Is there any, are you looking at all at expanding testing further in the future?
The issue about testing is where would you go next? There is no evidence that our diagnostic test is any better at screening than the questionnaire. I would argue that there's been issues with PEI and other jurisdictions, and we've had examples in our own province where people have tested negative on their first test and then subsequently turned out to actually have a coronavirus. So there are limitations to the test. We are open to whatever recommendations come out from Public Health Agency of Canada and Public Health. Capacity currently is not an issue. It's a matter of what makes sense and what will not mislead you with false negatives.
And just further to the Alert Level 1 question, you said in your opening statement that this could be our way of life until the end of 2021 and beyond. So I take it that doesn't mean we're not at Alert Level 2 through to the end of 2021. What are some of the criteria you're going to be looking at to meet in order for us to move to Alert Level 1 before then?
Well, I mean, it's a mix of metrics. With no cases, it's difficult, impossible to get an RT, so a reproduction rate. That is a very reassuring statistic of itself. The next thing is then what would the changes from moving from Alert Level 2 to Alert Level 1 involve? And how does that play against the background of other provinces and other jurisdictions? The principal thing around Alert Level 1 would be internally removing inconsistencies around events and differences between size of people, or numbers of people rather, allowed in a group. But in terms of what goes on between the provinces and the travel piece, that's maybe a different issue. We're in a very favourable position, and I think it's always worth repeating that we as a province have done exceptionally well. There have been, unfortunately, people who've been ill and people who've passed away, sadly. But given the situation that could have prevailed, we have as a province done very well. And I think the question then is about simply getting to a level 1. But these measures around physical distancing and masks and these kind of things, that's going to have to become our mainstay in whatever alert level we're at. And certainly if we move to Alert Level 1, that would be really important.
Our next questions are from Victoria Badcock of the OCM News. Please go ahead.
Hi there. Is there an update on the U.S. servicemen who arrived in St. John's and headed downtown last week? Did we get anywhere with that? Any more information?
Well, the information I have is that there was a lack of communication or a miscommunication. Subsequent to that, we have not identified any positive cases of COVID-19 in the metro area. Subsequent to their visit, we have met variously with Canadian Border Services. We have gone through the fixed base operators, the airport authorities, and we have made sure that any apparent discrepancies in communication have been dealt with. It is our clear expectation that these individuals are not exempt from isolation. We have gone to the federal government. We had excellent cooperation from Public Safety Canada, and we have also gone through the Military Liaison Department at the Department of National Defence in Ottawa, so that our allies are perfectly online and on side with our requirements. So all being well, this will not happen again.
Thank you. And we've been receiving some calls from choral groups and bands. Is there any update on the restrictions on singing?
No, it's another of those areas where, again, if you think about it, who on earth would have predicted a year ago that we needed a body of medical evidence on the environmental impacts of choral groups? This material doesn't exist. What we do know from other jurisdictions' experience is that one infected choir member infected 70% of the choir after one single choir practice. And that level of risk is huge. It's one of the biggest risk factors that have been identified outside of funerals for transmission of COVID-19. So what we've got to try and do is see what evidence we can generate to advise us how best to proceed. We have some of the best choirs in the world, the Atlantic Boy Choir, Shalloway, these kind of things. And it is tragic that these groups are suffering because of this pandemic. But at the end of the day, at the moment, all we have in the absence of major evidence, one way or another, is the precautionary principle, which is what public health relies on. And that's where we find ourselves in this situation. So we are as keen as any choral group to find evidence that will help us move this situation in a different direction.
Thank you.
Our next question is from David Marr of The Telegram. Please go ahead.
Thank you very much. A few of my colleagues and myself have kind of anecdotally noted that there's some restaurants, in the province are gathering kind of information that's helpful to contact tracing, and others don't appear to be. I'm just wondering, do restaurants and other spaces like that kind of, have the choice to do that, or is that mandated?
This was an issue with one of the restaurants locally in my own district not long after they opened up. It is a requirement of public health that we be able to go back and identify who was in a restaurant should that need arise. And there were two ways of doing that. One was to mandate that everybody was served only with a reservation, because that information is provided. You make a reservation at a restaurant now and you leave a name and a telephone number. Or alternatively, people could have drop-ins as long as they provided that same information. It's for the protection of the people involved. And I think one of the challenges we had in my own district was that somehow this was seen as intrusive by the restaurant owners. And it's not the restaurant owners, it was our recommendation, our requirement. If that is not being done, in actual fact, I would be open to interpretation possibly, and I'll go back and check with public health. But I think that might actually be an infringement of a special measures order.
Well, and on the note of this of special measures orders, I'm wondering if you can give some information on how the compliance has been, how many fines have been issued, stuff like that.
Enforcement is split between Service NL for businesses, Newfoundland and Labrador Liquor Corporation for licensed premises, and law enforcement, the RNC and the RCMP, as far as summary offence tickets and those kind of things are concerned. I do know that Service NL have issued stop work orders, and I do know that the NLC inspectors have been very active in advising whether or not they've issued any penalties or not. I would direct you to each of those groups. I'm not aware of the RNC or the RCMP issuing any summary offence tickets.
Thank you.
I'm going to go through each reporter one more time and see if you have any further questions. And once we're through that, we will end today's briefing. Peter Cowan, do you have any further questions?
I'm good, thanks.
Patrick Butler.
No, I'm okay, thank you.
Michael Connors.
You'd mentioned earlier that we could be looking at sporadic clusters in the future instead of one large second wave. Can you just sort of explain, is that something that we're projecting here, or what would that look like?
That seems to be the pattern in other jurisdictions, and it's certainly our limited experience here. We had kind of two little clusters, a cluster of one and a cluster of three, and fortunately, as I say, one of our strengths here is contact tracing, and that was done very rapidly and very expeditiously. And the individuals involved had acted entirely responsibly. So really and honestly, that would fit our pattern. This is the next best model, as it were, from Public Health Agency of Canada. And it will be interesting to see if and how that changes over time. It's a movable target.
Do you have any further questions, Michael?
I'm good, thanks.
Okay. Do we have any questions from Victoria Badcock of the OCN?
Since we have time, I am going to ask Dr. Haggie, how worried are you about COVID fatigue?
About COVID?
Fatigue.
It is a significant challenge, I think, as we go through this. I don't think it's been as much of a problem in reality as it has been in fact. The figures would suggest that we're doing well. But as time goes by, there is a behavioral tendency for people to lapse into old habits, trying to train yourself to new habits can take months and is not always successful. And I think one of the advantages of the media events like this is to hear Dr. Fitzgerald provide us with that continued stimulus to do as well as we have. I think that's one tool. Education and repetition are important. And I think peer pressure helps as well. We're starting to see that. I felt personally there was a change in the tone and nature of social media correspondence and commentary over the last maybe 4 weeks or so. And that has become much more supportive of people doing the right thing rather than simply kind of yelling at government because somebody did the wrong thing. And I think once you start to see that and individuals realize that this is a collective effort and we all have a part to play, and each of our roles may be slightly different, but we will succeed together or we'll fail as individuals.
Thank you.
And do we have any further questions from David Marr of the Telegram?
Yeah, Minister Haggie, I'm wondering if you could provide any kind of update on the on supply of personal protective equipment. As we say, we don't really know what's going to come in the fall, but just wondering if you could comment on our readiness.
Yeah, several things have happened actually, all in a sense to the good. Firstly, our burn rate has slowed down. Secondly, in terms of some of the items that are manufactured locally, we have, I think in one case, 7 years supply now of face shields. And we have received some of our January the 28th order of pandemic supplies, which gave us a significant boost in terms of ear loop, non-procedural masks. What we're looking at now is incorporating those through shared services in an inventory system whereby, if you like, you have a warehouse, the new supplies come in at one end, the older supplies go out at the other. And the question is, how long do you make that shelf and what's the shelf life of the material you're using? So we're not in a bad place. I would really like some areas of weakness to be addressed. We're still not perfect with the N95 masks. And we're waiting for our local manufacturer of gowns to spool up. But then I think there is an opportunity now to build up that inventory so that we have some more surge capacity. So it's nowhere near as critical as it was in April or May. And I think the individuals in the civil service, Tracy King particularly, and her team have done an admirable job of stick handling the mechanics of this to the point where we've come to where we are. So we're in a lot better place now. There's still room to improve, but we are certainly a lot better off than we were before.
I do have a follow-up. Oh, sorry.
Do you have one more question?
If you wouldn't mind, yes.
No, you go right ahead.
Thank you very much. Just relating to that question, previously I recall, I believe it was in the case of gowns that you had mentioned the price had like septuples in some cases. Does the local suppliers of personal protective equipment, remove that risk or remove the need to pay these higher prices for personal protective equipment, or have the prices for those items kind of adjusted as time has gone on?
Well, I think in general, the price of personal protective equipment in whatever jurisdiction you look at has gone up. It's a supply and demand. It's an economic equation. As to what the price would be of these locally sourced gowns, I don't actually have that information currently. I can certainly go away and ask the question on your behalf of staff.
Thank you.
Thank you, David. The time for questions has ended. And Minister Haggie, we're just wondering if you had some final remarks you'd like to make today before we conclude.
No, we'll be back, all being well, next week. It's I think, a very useful opportunity to get information out and to have this exchange. So thank you to all.
Thank you very much. Please join us again on Wednesday, August 12th, when we hopefully will have our new designated premier. Thank you very much.